Do you or someone you know have an autoimmune condition such as rheumatoid arthritis, Sjogren's syndrome, lupus, scleroderma, Hashimoto's, Graves' disease, multiple sclerosis, celiac disease, Addison's, pernicious anemia, myasthenia gravis, dermatomyositis, or diabetes, or any of the other dozens of autoimmune conditions? I'm Dr. Roy Picard, and my degree is in chiropractic, but what I do is above and beyond traditional chiropractic care. What I want to introduce you to is an option that many people are now using to support their autoimmune conditions. Now, depending upon your specific autoimmune condition, you may be considering, or perhaps you're already taking medications to decrease your autoimmune symptoms. Like most people, you have your doubts if the drugs are really working, and you may also have concerns over the potential side effects. What I'm going to do is explain to you that through proper testing and proper nutritional support, you may be able to decrease the flare-ups that are associated with your specific condition, and this can be done without lowering your body's immune system function. The biggest concern that I hear from people when it comes to immunosuppressive drugs is whether they are going to be, let's say, more susceptible to the different bugs that are passed around in society, whereas prior to taking the medications, they didn't seem to get sick as often. Now, some of the people are also aware that the medications with those, you're going to have the risk of excess cancer cell growth. In other words, part of the immune system is in fighting off cancer cells, and if you diminish that response of the immune system, there's a chance that your body no longer is able to fight off the cancer cells like it should. My extensive postgraduate training in functional endocrinology and chiropractic neurology has become very enlightening when it comes to autoimmune cases. Most of the patients I now work with are those that are chronically sick and are either not happy with the previous care that they've received from other facilities, or they're just looking for help in addition to the care that they're receiving from other doctors' offices. My additional postgraduate training, along with my 23 years of experience, allows me to help people where other healthcare providers have failed. I routinely see patients in my office who have been diagnosed with different types of autoimmune conditions, and I think it's safe to say that these people are usually the sickest of all the people that I see. Very often, the people who I speak with that do not have autoimmune conditions, they pretty much have no idea of the suffering that you're going through. They have no idea how it affects you physically, mentally, or socially. They don't understand the strain that it can have on your relationships and your family life. They just don't get it. And unfortunately, the same goes for many medical doctors. Some of them, not all of them, they just don't have the compassion or the necessary understanding of what can be done to help you make your life more comfortable and improve the quality of your life. Keep in mind that there is no cure for any of the autoimmune conditions. The goal is basically to decrease or minimize your rate of frequency of flare-ups. For example, if an individual, let's say, has lupus and they're unable to comfortably leave their house perhaps 3 or 4 days out of the week, and now after care they're only having a flare-up, let's say just once a month, that would be pretty much considered successful. You see, I'm not about treating your condition. I'm interested in finding out what needs to be done for you. I want to know your needs, your exam findings, and your test findings and what they're going to reveal. Proper testing is available to determine what can be done to improve your immune system and decrease the triggers leading to the flare-ups. There are many different triggers associated with autoimmune conditions. Sometimes these triggers can be identified, which even makes it easier to decrease your flare-ups. Triggers can be traced to such things as long-term infections, gluten sensitivities, hormone fluctuations, fluctuations in insulin, as well as many other causes. Now, I'm sure that you have a bunch of questions as it relates to what can be done and how all this works. My recommendation for you is to call my office at 586-726-9860 and call for a free consultation so that we can sit down and discuss your health history, explain in more details how I would go about trying to help you, and then answer all of your questions so that you can make an educated choice as to whether or not this type of care is what you're looking for. I wish you a much happier, healthier future, and I look forward to hearing from you.